Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Sunil Shedway. He is a senior consultant transplant surgeon at Sagar Hospital at Jayanagar as well as Banshankari in Bengaluru. He has many research papers to his credit, and especially one study of prevalence of human papilloma virus and its association with cancer of urinary bladder has been widely accepted and published. And today he is here to tell us about pancreatitis. In the previous episode, he told about the acute pancreatitis, and today he is going to tell us about the chronic pancreatitis. Please tell us what is this acute and chronic, and what is the difference?
Yes, ma'am. So last time, as you told, we discussed about acute pancreatitis. Acute pancreatitis is a temporary problem. Somebody takes alcohol or because of some gallstone, there is swelling in the pancreas. And majority of the times, if they get right treatment, the problem subsides. It is called as acute pancreatitis.
Okay.
But in chronic pancreatitis, the patient will have continuous problem of the pancreas, and finally the pancreas will completely get destroyed. It's a progressive disease, and currently we don't have any cure for chronic pancreatitis. Once the chronic pancreatitis starts, slowly it progresses, the complete pancreas will eventually get destroyed, and the patient will have problems related to pancreas, like the juice which is required for digestion is not secreted. The patient will have indigestion. In medical terms, we call it as steatorrhea, and they will also have full-blown diabetes. So this is called as chronic pancreatitis. It's the other variety of pancreatitis. As I told you, acute pancreatitis resolves, but in some patient, if they have very severe acute pancreatitis, eventually they can
And
also get chronic
that will
pancreatitis.
continue as a chronic. Okay.
Yes, but the problem with chronic pancreatitis is continuous non-stop pain. The patient will have continuous pain, and that is never going to subside. So it's a very debilitating disease to have.
So apart from the continuous non-stop pain in the abdomen, and then the appetite and indigestion, what are the loss of weight? What are the other features?
So, as I told you, ma'am, one of the main cause for acute chronic pancreatitis is alcohol. Acute pancreatitis, one of the cause is alcohol, but it is the second most common cause. First most common cause of acute pancreatitis is gallstone disease. But for chronic pancreatitis, the most common cause is alcohol. So, once they have alcohol for a long time causing chronic pancreatitis, they can also develop liver disease. So, we see patients with coexisting liver disease with chronic pancreatitis. Other thing is weight loss, as you told, because they are not having enough digestive juice to eat and gain weight, so they will have weight loss. Apart from that, they are prone for infections. We see a lot of patients of chronic pancreatitis coming to us with tuberculosis. So that's the other manifestation.
So that means their immunity is low and they are not able to fight with any bacteria or the viruses. The disease fighting capacity goes down.
Yes, because they are malnourished. And all these patients who have chronic pancreatitis, they are predisposed to pancreatic cancer. So chronic pancreatitis is a pre-malignant disease. So the patient can have pancreatic cancer over time after 10 years or 20 years.
Okay.
So these are the common symptoms apart from pain.
Pancreatitis continues, and over that the stone formation can occur. The cancers also can be grow, and then they can end up with the terminal disease.
Yes.
Oh, so that means what you're trying to tell is like how Osama bin Laden hit the Twin Towers. This alcohol is hitting both Twin Towers, that is our pancreas and liver, which both are required for digestion of our food and then making us strong. So both are hit, and that's how the health will go down. Okay.
Yes, ma'am.
Then how do you investigate and how do you confirm the diagnosis?
Chronic pancreatitis, ma'am, generally is a clinical diagnosis. So a young patient who is coming with chronic abdominal pain radiating to the back, who has lost lot of weight, they will have steatorrhea. Like whenever they eat oily food, they are not able to digest. and then they are going to have brittle diabetes. So based on all
Oh,
these clinical features, initially we make an impression
what do
of
you
chronic
mean? What do you
pancreatitis.
mean by brittle diabetes?
Brittle diabetes
What
means
is
whatever
brittle?
medicines you give, it is not getting treated.
Ah, okay. Resistant.
Yeah,
It
and
is a
then
resistant one. Huh.
yes, ma'am. Then generally we send some blood tests like amylase lipase to rule out acute pancreatitis. We'll also do LFTs because they have weight loss, they are not eating well, so albumin will be on the lower side. So after this, we will do some kind of imaging, ultrasound or a CT scan or a MRI. And as you said, on ultrasound or CT scan on MRI, if you see calcifications or stones in the
Yeah.
pancreatic duct, calcifications in the pancreatic parenchyma, or duct strictures, which you can appreciate on MRI or CT scan, dilated duct, pancreatic duct. All these things will probably tell you that the patient is having chronic pancreatitis on imaging. We also
Okay.
send because whenever a patient has having chronic pancreatitis, there will be less enzymes in the digestive juice, and that we
Okay.
can diagnose by sending stool test. We do something
Okay.
called as
Okay.
fecal elastase, and that will tell
Okay.
us whether the patient has chronic pancreatitis or no. So these are the
Oh,
common tests we generally do. Obviously, if you are suspecting chronic pancreatitis with pancreatic cancer, then you may have to do a PET scan and all those things.
okay. Okay.
Very
So
early
if
chronic
you,
pancreatitis, we do something called is endoscopic ultrasound. Very early
oh,
pancreatitis sometimes cannot be picked on CT scan or ultrasound. For that, you
ah.
have to do endoscopic ultrasound, which it can pick.
So
Supposed to be
where do you
very.
put the endoscope into the stomach and then to the duodenum?
Yeah, so what
Or
happens, ma'am, in endoscopic ultrasound, you have an endoscope and in front of that there is an ultrasound probe. So you can look at the
camera?
pancreas in the stomach or in the duodenum. From stomach, you can look more easily the tail and body of the pancreas. If you want to look at
Pancreas.
the head of the pancreas, then you have to see it through the duodenum. So
Okay.
that's how we
Okay.
do endoscopic ultrasound.
Okay.
It
Okay.
is
So
helpful when you have a very early chronic pancreatitis.
okay. Okay. Which cannot be picked up by the other ultrasound or MRI, you can pick up much
Yes, ma'am.
earlier.
Yes,
Okay.
ma'am.
Now, what is the treatment modality? How do you treat?
Yes, ma'am. So unfortunately, chronic pancreatitis is something where there is no permanent cure. We have to understand. The disease will slowly progress and eventually the pancreas is going to get totally destroyed. So
Okay.
all the treatment what we are going to do is to slow the progression of the disease and to control the complications because of chronic pancreatitis. We have to understand that. So
Okay.
what we
Okay.
generally do, firstly the inciting factor. As I told you, smoking and alcohol are most common causes of chronic pancreatitis. The patient has to completely stop it. If they don't
Yeah.
stop it, the disease will progress very fast. So
So
they
the
have to
causative
completely stop.
causative substances must be abuse must be stopped for once for all.
Yes.
Okay.
Yeah. And they
Okay.
have to completely stop. And then next comes the pain because the patient will have debilitating pain. They cannot do anything. So we have to give optimal painkiller to make sure
Okay.
that the patient is pain free and he can continue his activities of daily living.
But
Apart
this
from that,
painkillers, it has to be given chronically, no? Because it's a
yes, ma'am.
chronic disease.
Yeah, but
So constantly they keep on taking.
yes, ma'am. But we have to
Uh,
make sure that they don't. Sometimes the patient has tendency to get into
get
narcotic
addicted.
abuse because
Okay.
they have
They
tendency
get
of alcohol
addicted.
abuse. Yeah,
Hmm.
so we have something called as WHO ladder. So
Hmm.
based on that, we have to treat the patient and make sure that they don't get addicted. So that's the most
Okay.
important because they can have narcotic addiction sometimes.
Okay.
Apart from that, I
Okay.
told you that they have steatorrhea. They are not able to digest food, especially
Hmm.
fat components. So we give enzyme supplements. We have nowadays pancreatic enzyme supplements. Patient takes
Hmm.
it before food, and then he has food. So we give that. And as I told you, if they have diabetes, we have to control the diabetes
Diabetes.
well.
Hmm.
Yeah. But it is very important to tell the patient that it's a chronic disease which is going to eventually progress, and then they have to be on lifelong follow up and stick to whatever advice doctor has given and be on follow up with the doctor regularly. That's very very important.
So you are saying that lifelong abstinence from the smoking and drinking,
Yes, ma'am.
lifelong treatment with the enzymes, and
Yes, ma'am.
lifelong treatment with the other painkillers. So this is
Yes, ma'am.
how they have to be until the last day. They have to take that. Now,
Yes, ma'am.
suppose they have come to in the terminal stage
Yes,
and
ma'am.
nothing works. At that time, what you do?
Yes, ma'am. So one thing we need to understand, if the patient completely becomes pain free, then as a surgeon we generally don't intervene. So unless
Okay.
there is some malignancy or something. But we also have, so far we discussed about the medical management, but if it doesn't get better with medical management, we have something called as endotherapy. We can give endoscopic treatment. So if the
Ah,
patient has few stones and the pancreatic duct there are some strictures, we can
okay.
do endotherapy. We can put a stent, we can extract the
Okay.
stone, we can give lithotripsy
Okay.
and break the stones and remove the stones. That's
Okay.
one treatment, endotherapy.
Okay.
And then the
No,
other
but
treatment is
if these stones are there in the duct, you can. But if they are in the parenchyma, in the body,
no, then the
how
surgery
will?
will be the option. Surgery will be
Ah,
the option.
okay.
So
Okay.
we do something called as lateral.
Ah,
There are multiple types of surgeries, but the commonly done are LPJ or phrase procedure. So phrase
okay.
procedure is something, because there is a pancreatic duct stricture and pancreatic duct is dilated with stones.
Ah,
We open the pancreas, we open the pancreatic duct, remove all the stones, and we anastomose jejunum to the pancreatic duct. So,
okay.
and then at the same time, we will core the head of the pancreas, because head of the pancreas is considered to be the pacemaker of the pain in chronic pancreatitis. So, we
Okay.
core the head, we open the duct, and then we anastomose it to the jejunum. So that is
Oh.
called as phrase procedure, and that's one of the standard treatment, surgical treatment for chronic pancreatitis, which is not responding for medical management, or which is not a good scenario for endotherapy. So that's one.
So since it is in the you're doing it for the terminal stages, what are the risks of doing this surgery? Is it a high risk surgery because he's already has got many target organs involved like liver, stomach, and everything. So
Yeah,
how
ma'am.
risky is this? Yeah.
No, it's a fairly standard procedure. Obviously,
Okay.
should be done by specialists who are trained in pancreatic surgery, but it's a
Pancreatic surgery.
fairly
Hmm.
straightforward procedure.
Okay.
So, like obviously, all surgeries have risk, but it's not a
Yeah.
very extraordinary risky operation. But it's a
Okay.
safe surgery, and experienced surgeon can very well do the surgery. The other treatment nowadays, which is evolving, currently not available in India. When
Hmm.
I was a fellow in University of Minnesota, so we used to do routinely there islet
Hmm.
cell transplant after doing a
Okay.
total pancreatectomy. So you
Okay.
remove the whole pancreas, because that's causing continuous pain. So
Okay.
remove the whole pancreas, then you
Hmm.
take the pancreas to the lab, extract the islet cells, bring back
Ah.
the islet cell and infuse in the portal vein. And those islets
Okay.
will eventually settle in the liver
They'll
and
go to the
start
liver.
secreting insulin. Yeah, and they will
Okay,
start secreting
okay.
insulin. The fellow in University of Minnesota, so we used to do routinely there islet
Hmm.
cell transplant after doing a
Okay,
total pancreatectomy. So you
okay.
remove the whole pancreas, because that's causing continuous pain. So
Okay.
remove the whole pancreas, then you
Hmm.
take the pancreas to the lab, extract the islet cells, bring back
Ah.
the islet cell and infuse in the portal vein. And those islets
Okay.
will eventually settle in the liver
They'll go
and
to the
start
liver.
secreting insulin. Yeah, and they will
Okay,
start secreting
okay.
insulin. So that's a islet cell transplantation after doing total pancreatectomy. This treatment is currently not available in India, but it
Yeah.
is available abroad. It's one of the standard
And I
treatment for
think
chronic pancreatitis.
shortly it will start since you are
Yes, ma'am.
already trained with that and you can start with that and
Yes,
now
ma'am. Yes,
your
ma'am.
insulin is okay. What about the enzymes, pancreatic
For
enzymes?
Yes, ma'am. Enzyme part is fairly simple, because we have nowadays capsules available, gastric
Okay.
resistant capsules. So we just ask the patient to take it before having food. But
Hmm.
most important thing in chronic pancreatitis is patients are malnourished, so they have to
Okay.
eat well. So what unfortunately what happens is, everybody, whenever patient who have pancreatic problem, who have liver
They
problem,
cannot
everybody
eat
tells them
because
to,
of the pain. Because of the
yeah,
pain.
so they don't eat well, and
Hmm.
they avoid proteinaceous foods. So it's very important for all the patients who have pancreatic diseases or liver diseases to have good food with lot of protein. So if they
Okay.
have good food with lot of protein, plus they take enzyme supplementation, then probably the malnutrition because of chronic pancreatitis can be very well taken care of.
Now, finally, what is the key message that you would have like to give it to the youngsters to prevent this chronic pancreatitis?
Yeah, so most common, as I told you, most common cause is alcohol and smoking, and these two are easily avoidable. So if you are a alcoholic or a smoker, straight away stop it, and the people who have not yet started, better stay away from it. So that's the most important message I would like to give, ma'am. Because apart from uh, chronic pancreatitis, smoking and alcohol is associated with lot of diseases in the body. So it is better to stay away from it. And if you are already into it, better to quit it.
Okay. Thank you very much, Dr. Sunil. So the youngster should realize if they want to succeed like Sunil and be healthy, keep away from that.
Yes.
And if they want to live long like me and again continue to work, stay away from the smoking and
One
the
last message, ma'am.
film.
Sometimes patient
Yeah.
may find it difficult to quit, so they have to
Yes.
get in touch with
De-addiction.
their psychologist or psychiatrist and help them to quit
Yeah,
the
yeah.
smoking and alcohol if it is not possible.
So, yeah, now this de-addiction clinics are there all over,
Yes.
and especially in Nimhans, in the whole country, the first female de-addiction ward is started. So even if the women are addicted to the smoking and alcohol, and they should go and get admitted and then get rid of this very, very bad habits. No? These are the bad habits can destroy your whole life.
Yes.
Yeah. Anything else?
That's it, ma'am.
Yeah. Thank you so much, Dr.
Yeah.
Sunil.
Thank you,
You
ma'am.
are so clear, crystal clear, and carried the message so well. And I'm sure all of viewers have learned a lot from you. Thank you very much.
Yeah. Thank you so much, ma'am. Thank you. Good day.